Hi, I'm Dr. Kelly Starrett, and sometimes when using HWave technology, it's useful to have a case study around a tissue system or joint. Now, here's the key. I'm going to be our case study today because turns out I am 13 weeks status post total knee replacement. So I'm going to tell you about the different ways that I can use the HWave device to, one, continue to help decongest and manage swelling from the loading of the tissues post-surgically, and also how I've used it post-surgically immediately to help manage pain. So the goal always with the human is to restore as much motion as we can, to restore the ability to load the tissues again. This is ultimately our goal, not to just stay in bed and continue to move. Now remember, sometimes the problem with being in persistent pain or chronic pain or having sort of guarding reactions of my body perceiving a tissue or a movement system as threat is that I'm less likely and less excited to be able to get the amount of movement required to decongest the tissues, to simply dump the lymphatic system, in this case, the sewage system of the body. But after a surgical event, for example, one of the things that happens is that we've sort of cut through some of the associated vascular networks. Some of the capillary beds have been disrupted. I've had this tissues that are knitting up. And as we load them, we're going to kind of continue to see some additional swelling as the tissues are going about trying to heal themselves. So again, let me show you how I've used this device around my knee, and it'll make it a little bit easier. The first thing to keep in mind is that our chief goal is to get as much non-fatiguing muscle contraction in the tissues as we can. So what I've done here is I'm going to set up a couple pads on places where I know I got good results. So I'm putting these right here on my quadriceps. Now, the HWave comes with two different leads. So this first lead is, you can think of it as like a circuit. And what I'm going to do is turn on the device, select low frequency till the light is blue, and then I just dial this up until I get a comfortable contraction. So one of the powerful reasons I love this technology is that I'm able to work really hard during the day, sometimes pick up my kids, be a member of my family, and then I get a little bit behind and I'm able to pump all night long, which is like resetting my tissues back to zero the next day. So one of the goals here is that if we can get some motion into the tissues, you can see here that my quadriceps is contracting, my knee is moving, my patella is moving. And so what's happening is my brain is starting to perceive this as non-threatening movement. So I'm beginning to load these tissues and keep them sliding. This keeps the muscles connected to the brain, but also continues to load the tissues in the way they would normally be loaded. So if I'm looking at rebuilding scar networks or tissue networks after surgery, just the contraction of the quadriceps, like me actually doing this with my brain, is still going to load the tissues appropriately. So what's great here about this, and this is what's a little bit sort of misunderstood, is that it's absolutely okay to move the pads around until you get a great contraction. So the idea here is that you'll begin to play with different circuits, but pretty soon you'll have a good idea of how to get a good contraction in your tissue. So if I set myself up here and I'm not getting as quality contraction, all I have to do is move the tissue around or move the pad around until I get the kind of contraction I'm after. Now, the magic here, as I mentioned before, is that I have two leads. So the second lead I'm going to put on a place where I tend to see a lot of swelling in myself, or sort of edema, what we call pitting edema, and just the tissues around the shin become a little congested. I'm also going to put this up in my adductor on the inner thigh. And the idea here, my thinking is, hey, this is where the whole sort of vascular network is decongesting up at the groin. So once again, if I turn on this low frequency and start to adjust this, you can see that my foot is now moving because my anterior tibialis is going, and I'm getting a great contraction to the groin here. So what happens now is, if I'm content with this, this allows me to decongest an entire system. It's pretty amazing that I can set this and run this thing, not feel fatigued, not have tissues be sort of irritated from pumping, and I can basically get tons and tons of movement, even though I may not be able to walk as much as I'd like or even ride the bike as much. So this is a powerful way to decongest. Again, low setting. And I can put this on hamstrings or focus on different aspects of my body that allow me to manage the swelling. In this situation, I've got something going below, I've got something going on above the joint. An easy way to think about this, but it doesn't really matter. It matters less. Now, if I'm feeling like, hey, I've got some irritation in the system, I can think about using one of the leads now is high frequency. And remember, that high frequency is a little bit different energy signature, which instead of causing the muscle to contract, basically gets the brain to think differently and perceive differently about what's happening. So 45 minutes at a time, I can do a lot to make my joint and tissue system feel better. So it's really simple to think about. Wherever I have two pads, when I use high frequency, the place between the two pads is going to feel numb or buzzy. It's an easy way of thinking about this. So in this situation, I've got a high frequency pad set on either side of the joint here, and I've got low frequency still working on the quad. So I can get myself into some high frequency here. And what I tend to do is turn on the high frequency first. And what I'm starting to feel is, again, a little bit of buzzy, a little bit of kind of tingling through the system. And as my body kind of adapts, I can turn this up and it feels very comfortable. And now I'm actually, feels like I can't even perceive what's going on. So now I'm getting some real pain relief in this joint system. And then I can turn the other lead back up and still congest. So I'm able to do this thing simultaneously. We don't have to be trapped in only pain management or only fluid management in this situation. I also, if I'm having someone with really, really severe experience, we can set up multiple pads, and here I've got crossed the joint in multiple ways. Or let's say I had a really sore quad ligament. I can go on either side of the quad ligament here and either side of the joint, set both to high frequency and run this and get real on-demand relief. And so what's happening here is now I've got a 45-minute window where I can give myself some relief, and what we tend to see is long-lasting relief. So that I can do what? So that I can come back to low frequency. So really, the goal here, again, is to get our bodies in a position and in a situation where we can continue to move during our day and restore our ability to move and interact, to do our jobs, to interact with our family, to play again. And what's nice about this technology is that with my elite athletes and Olympians, it allows them to decongest or manage a little bit of kind of pain and niggly spots at the highest level of performance. For our patients with chronic pain and persistent pain, we now can have massive inter-session change where they're not seeing their physician or physical therapist, can manage their pain, manage their swelling, even though they can't count on the moving. And what we see is that on either side of this spectrum, the same technology, the same principles drive the adaptation of the human, the person's ability to feel like I've got some control over my body. So again, in this situation, I'm still probably pumping 20 to 30 hours a week. Why? Because I'm loading my tissues and then I'm able to stay ahead of the congestion. And if I feel a little bit sore, I jump on the high frequency. But mainly, the idea here is I can either say at low frequency and pump, I can do a combination of some pain relief plus pumping, or I can focus just on pain relief. And hopefully that makes it a little bit easier to understand how we apply this technology to a system like the knee.